and we're going to welcome our guests today. We have both Patricia Harrison-Monroe, PhD, and Gustavo J. Perez, PhD, and we appreciate you very much for joining us today. I'm going to give a brief introduction of each person, and then I will turn it over to the two of you. But thank you so much for joining us, and we really appreciate all the efforts of your organization over the next 2 weeks, and I think it's a great offering for our community. So thank you so much again for helping us. So Patricia Harrison-Monroe, PhD, is an associate professor and vice chair and director of community outreach and clinical development and director of early psychosis in the Early Psychosis Intervention Center, which is an amazing center here in Tucson. Dr. Harrison-Monroe is an active member of the community and serves on numerous committees and boards, including the Pima County Crime Victims Compensation Board and the Pima County Domestic Violence Fatality Review Board. She's received numerous honors, including being recognized as one of the 25 most influential African Americans in Arizona, is a member of the College of Medicine Faculty Diversity Advisory Committee, and serves on various additional College of Medicine committees to address medical students and community mental health needs. Prior to moving to Tucson in 2002 with her husband, she was assistant commissioner with the New York City Department of Mental Health. Our second guest today, Gustavo J. Perez, PhD, is assistant professor and lead psychologist at the Early Psychosis Intervention Center. Dr. Gustavo Perez is a certified trauma specialist working with people experiencing serious mental illness. His work is grounded in a biopsychosocial approach to mental health. He leads the CBT Mindfulness Series, Cognitive Behavioral Therapy Mindfulness Series at the Banner University Whole Health Clinic. He is also a community educator for the Department of Psychiatry, promoting awareness of early mental health intervention for youth and families. Prior to joining the department, Dr. Perez was the senior psychologist at the Pima County Juvenile Detention Center, where he was recognized with the 2016 Employee of the Year Award. Dr. Perez serves in a Safe Environment Review Board with the Catholic Diocese of Tucson. That was a mouthful, but we are very happy to have both of you here. And Patricia, why don't you take it away? And thank you so much for joining us.
Absolutely. Thank you so much for the lovely introduction. It's too long, but I appreciate it. So good afternoon, everyone. I really look forward to this opportunity to join you in a conversation about mental health in this time of COVID-19. Dr. Perez and I will alternate a bit. I will start off with an overview of some of the challenges. Then he will go a bit more into detail about anxiety and depression. I'll come back to review some basics of what we can all do to cope better. And then Dr. Perez will cover the importance of staying connected. We really want to leave sufficient time to answer your questions at the end. So we'll get started, and hopefully some of your questions will be addressed while we speak. So as the introduction said, I'm vice chair in the Department of Psychiatry here, and I've been with the university for about 15 years. And I have to say, during this time of pandemic, my role has shifted significantly. There's much more of an emphasis on kind of the ever-increasing need for direct clinical care. So I've been doing a lot more clinical work than administrative work lately. I'm part of a team at the College of Medicine that is available to enrolled medical students to obtain free mental health care. I also teach and clinically supervise some of our residents and fellows. And then I also have a private practice where I see members from the community for therapy, including a number of faculty. The people I see in therapy are primarily struggling with anxiety and depression. That is not out of the ordinary, but what has really changed, the change that I've seen, is the intensity and the severity of symptoms and suffering, as individuals are really trying to adapt and learn to cope with the unremitting stress of living through this pandemic. So the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. These days, even if you have no or few physical complaints, I would think that it is probably a challenge to live up to that definition. I know, I admit up, when I wake up with fewer aches than when I went to sleep, I'm pleasantly surprised. So now that I'm in my 60s, I've set my bar just a little lower, but I'm still striving for that ultimate definition of health. One of my patients said to me recently that somebody had said to her, well, at least you have your health. And in these times of global pandemic, she immediately kind of almost took offense because the thought that she had was, yes, but for how much longer, right? And so, but she didn't say it, but she was rattled by that because it's a common phrase, but now in these days, it doesn't apply in the same way. It makes sense, of course, that with infection rates rising, much emphasis is placed on physical health, on physical symptoms, on avoiding infection, avoiding transmission, hoping not to get sick with anything that might require a trip to the doctor, to urgent care, or scariest of all for many, a trip to the emergency room. But we also know that the body is not separate from the mind, that our thoughts and our emotions do not exist in a vacuum. We are whole human beings, and there is no way around experiencing our current health emergency really without it affecting how we feel and how we think and how we perceive and how we respond to the world around us. We know that we all have limited capacity for stress, and these are truly unprecedented stressful times. Stress affects our physical health. It affects our ability to fight infection and inflammation. It impacts hormone regulation, which really does a number on our bodies. Clearly, there are a lot of things that cause us stress. Things that we can worry about and that we do worry about. Will I be laid off? How can I pay my rent? Will I be evicted? Am I running out of food and supplies? What should I do with my kids when school starts? And even things more recently, things like, should I make a will? Should I change my advance directives? Should I change that do not resuscitate order? Many of the adults I see are really struggling, particularly with those concerns. But many of them also generally lack access to legal advice. They don't have ready access to trusted people with whom these kinds of things can be discussed. So extreme and prolonged stress can affect how well we cope with everyday challenges. And for some who are already struggling prior to this, who were already challenged by depression or anxiety, it can truly intensify their experience. But for all of us, it can result in irritability and in anxiety and insomnia and depression, burnout, maybe a sense of just not caring anymore. It can lead to traumatic stress, to hopelessness, even to suicidal thoughts. Weeks in virtual or actual lockdown, in physical isolation with a lack of social and intellectual stimulation can also result in a noticeable mental decline. And that's particularly important for those of you who have aging parents, that you are paying attention to that. That if you see a true kind of significant reduction in memory or word finding, that you pay attention to that. It is likely about the lack of stimulation, right? Many expected to kind of live through the spring, following the public health guidelines with the hope that the summer and the heat will impact the virus in such a way that our lives could reasonably return to normal. Well, here we are in the midst of July. A few days ago, it was 114 degrees, I think. So it's hot, but social distancing is still recommended. Wearing masks is still recommended. Infection and death rates are up. And now there are forecasts for surges in the fall, intersecting with, the annual flu season. And that leaves many fearful that this will, I don't know, never end, right? And that this threat, it seems to continue to evolve daily as we learn new things. And so this lack of control that many people are experiencing, a lack of control over their sense of personal safety, their concern for the safety of their families or loved ones, a lack of clarity about when and how their lives will return to some level of predictability, dealing with job loss or dealing with the loss of places that used to connect us to our communities. And then for some, mourning the actual loss of friends and family members, dealing with the trauma of not having been able to be there with their loved ones in the last moments, worrying about seeking care ourselves in hospitals, fearing maybe to die alone. There are no visitors. It can be absolutely overwhelming, and it is for many people. Among all the unsettling things, one additional unsettling thing I've noticed, in addition to this pervasive stigma that already exists against seeking mental health treatment, there is now this added stigma associated with COVID-19 that has also, or seems to be, significantly impacting people's willingness to seek help. Yes, it's a disease that's new and for which there still are many unknowns, although every day brings new information. We are often afraid of the unknown. And particularly in times of stress, it is easy to associate that fear with the other. And I think we see this particularly in aggressive incidents towards members of the Asian community, where they are targeted as if they personally were responsible for the situation that we find ourselves in around the world. I also have a lot of people that tell me that they don't wear masks because they don't want others to think that they are or have been sick. And I stress to them that we know that unprotected sneezes or coughs, for example, can propel the virus up to 30 feet. It's all very frightening, but people have lots of reasons of how they are unable or unwilling to cope right now with some of the restrictions. It's just too much. It feels like it's just too much. Another concern is that we know that the health status of underserved and minority populations is significantly compromised. They often have a higher incidence of underlying health conditions that put them at higher risk of contracting the virus. They also often don't have kind of the option of working from home, from the relative safety of their living room, connected via their computer if they have one. They also may have jobs that take them out into the community where they are exposed and at risk. And they may not have access to health coverage or sick days or really even know where to get mental health services. Lots of barriers for lots of people. A growing number of people are really starting to struggle with the isolation and loneliness that they feel. And depending on your age group, it likely affects you differently. Loneliness and isolation are particularly debilitating for older adults. As a result of the closures, many of the ways in which we used to interact, school, work, going to restaurants, to social clubs, the grocery store, parks, engaging in volunteer opportunities, those are not available or in very limited ways. For older adults who are living independently, some of that isolation may be self-imposed in an attempt to stay safe or keep others safe. But for a larger group of people, for example, those who are living in nursing homes or other congregate care facilities, their experience was that they were locked down for weeks, even months, without the ability to maybe just even walk down the hall. They're having to sit in their room, eat in their room, live in their room, interacting really only minimally with staff. And those staff were wearing protective gear. So they were in masks and face shields and gowns. Very distancing, very isolating, right? They may have witnessed neighbors or friends getting sick, dying. Being physically isolated, no visitors are allowed. These are no doubt traumatic circumstances. And we will see, I think, the effect, the mental health effects lasting for a very long time. We don't really know all of the effects yet. As I told an audience last week, much of my family is back east. My husband and I, we were supposed to go to New York just when the pandemic started around the early part of March. So of course we didn't go. As it got worse, my son and his family actually considered driving here because Arizona was, relatively safe. Now, of course, I'm glad that they didn't, but I miss hugging my grandson. Watching him starting to walk or talk via video phone is great, but it's not the same as being there. And I admit I have moments where I just want to jump into the car and just drive to New York. I miss hugging my mom. I see her daily. I get to see her daily. I'm lucky that way. But I'm also very conscious that she's in her 80s. And although I'm very careful, I just don't want to take the risk. And as a widow living by herself, I know that she also misses kind of the physical contact of getting a hug from me or from my husband. So, of course, the reality is that there is no actual safe place right now. You can certainly mitigate the risk by following the various measures that are repeatedly outlined, like masking and social distancing and hand washing as much as possible, and staying at home if possible. It's vitally important, I think, to recognize that we all have different coping strategies and different access to resources. And we need to try to utilize those as best we can. But even knowing that, that doesn't necessarily decrease the experience of anxiety and sadness and fear of what's to come next. So with that, I'm going to turn it over to Dr. Perez. He's going to take us through some of the specifics about anxiety and depression. And please keep those questions coming.
Thank you, Patricia, and thank you, everybody. Thank you for joining us today. It is a pleasure to be here with all of you, wherever you are. So as we continue to cope with this loss, this uncertainty that the pandemic has brought to our lives, it is important to keep in mind that each one of us is going to be affected by this crisis differently. And every day may be a little bit different. Therefore, it is important that we keep checking with ourselves and we ask a very simple but essential question. How am I doing? And if the answer that comes back to you is no well, you are not alone. If you are feeling depressed, you are feeling anxious, many people are experiencing the same. The numbers tell the story in our nation. And of course, we know it's a problem worldwide. In the United States, to share some examples, from the beginning to the end of March 2020, the Mental Health National Helpline had a 5-fold increase in the numbers of calls they received, 5 times as many as last year. In Pima County, in March and April 2019, we had on average 2 people taking their own lives, 2 per week on average last year. This year, sadly, for March and April, we had on average about 6 people committing suicide. The numbers tell the story. We're not doing very well. You can also tell from the content and the tone of our daily conversations. Just yesterday, I say hi to a father as I was walking, and I say, "How are you doing?" His answer, "Surviving." Our greetings have changed. Now we ask each other, "How are you holding up?" We tell each other, "Be careful, be safe." So, as Dr. Monroe talked, depression and anxiety were fairly familiar with these symptoms. Depression, we define it as a state of low energy, low motivation that impacts the way we feel about ourselves, about the future, about others. We call it mental illness, but in fact, it is felt in the body. We have trouble sleeping. We may have trouble eating, or we may be eating too much. The same thing happens with anxiety. Anxiety, which I describe as that feeling that something is a problem and we're not going to be able to handle it. There are symptoms such as restlessness, problems concentrating on tasks. It's very hard to think of something else when we are worried about how we're going to deal with everything that's happening. We may experience muscular fatigue, muscular tension, our bodies are tired. We may become irritable. Irritability, even anger, can also be an expression of depression or anxiety. Now, if that's something that you're experiencing, what I would like to tell you right now is that it is okay. Unfortunately, we continue to have a lot of stigma around depression, anxiety, or any type of mental illness. We live in a society where weakness is not welcome. The general discourse is constantly focused on being faster, being stronger, make it to the top. I find it very telling that we have 9 Fast and Furious movies. Where is the movie that is called Slow and Not So Furious? I don't think that movie is ever gonna be made. It's not something we value as a general culture. My point being here is that we as a society, as a culture, have not embraced talking to each other about the way we struggle. And yet, here we are, struggling in so many ways and on so many forms. I often tell my clients when they come into my office, of course you're feeling depressed, of course you're feeling sad. Look everything that you're going through. And as I witness the struggles that people experience, they carry a lot. Many of you carry a lot. It makes perfect sense to me that you may be feeling depressed or anxious. It's not a pathology. It's an expected, I would say, normal reaction to the challenges of our times. The fact is also that we were struggling prior to COVID-19 in many ways. One specific way how we were struggling as a society was the increased number of people who were feeling isolated, disconnected, chronically lonely. Just to share some numbers with you, to have some perspective here. In 1980, 20% of adults in the United States reported feeling lonely at any given point in time. In 2019, last year, a national survey of lifestyle indicated that up to 40% of adults in the United States reported feeling lonely, twice as many. This was before COVID-19. With COVID-19, that feeling has been exacerbated. Social distancing is not helping. our common gathering places are closed, it is much harder to feel connected to others. Now, social scientists have described isolation as the public health risk over time, and they have good data to back that statement. It has been demonstrated that chronic loneliness, the constant feeling of not belonging, has a significant impact in our emotional health and our physical health. When we're lonely, we become more hypervigilant. We are more likely to perceive danger where none may exist. Loneliness increases cortisol level, the stress hormone. It decreases our quality of sleep. We have a lot of micro awakenings during the night. It is a condition that can significantly impact our emotional health and our physical health. Now, as we continue to experience the loss, the uncertainty, the many questions that we still want to answer about what does it mean for us to go through this, a good question to ask is, do we have any options? Is there something I can do, we can do, is one of us can do to cope with this anxiety, depression, irritability, difficult emotions that show up? The answer is yes. And think about it. As we reflect in our human experience, our collective human experience, but also a personal one, adversity is part of life, indeed. But we also know that as humans, we have the ability to cope with adversity, even grow from it. That's one of the reasons why I'm a trauma therapist, because I know there is growth from adversity and difficult times. I've witnessed that day after day in my office, even now. So that quality of being able to cope with adversity and even grow from adversity is known, as you may be familiar with this term, as resiliency. Now, the good news about resiliency is that it's not a fixed trait that some people have and others don't. It is more like a way of being, a way of coping, a way of being present that can be grown, that can be learned, that can be nurtured, that can be acquired. It's available to everybody. Young people, old people, introverts, extroverts, cat lovers, dog lovers, coffee drinkers, tea drinkers, the list goes on. My point being, and you are probably already doing that. Most of us in some capacity are. The truth is that we're here today. So as we continue to face the many challenges of COVID-19, one good question to ask is, what are the factors, what are the variables that social science says help a person to build more resiliency in their lives? And that's where we're gonna go next with our presentation. Dr. Harrison-Monroe is gonna talk about the basics of resiliency, and then I'm gonna come back and talk about why it is a good idea to stay connected.
Okay, thank you. I would say above all, it's been my experience that setting a routine is really important. So I'll talk about the basics. We'll start us off with that. The kinds of routines that I've already mentioned that we've counted on in the past, such as going to work or going to school, maybe going to a place of worship, going to the gym, restaurant, bar, park with friends or family is just often not possible, if not totally prohibited, depending on where you live right now. But even if you are mostly at home, it's nonetheless really important that you maintain a routine. I have to say that the first 2 weeks of working from home was very disorienting for me. Not all the online meetings were set up yet, so there was a lot of downtime. I was checking back and forth with people. Are we meeting? What platforms are we using to have these meetings? I wasn't at all used to providing therapy online. And I would say I was probably in denial how bad things would get. And so only half-heartedly considered how much time I would need to be spending away from the clinic and from my office. But once it became clear that this was not going to end anytime soon, I set out to develop a routine. I set up my home office. I set work hours. I learned how to use Zoom and other platforms, and that was somewhat challenging. And I said goodbye to my husband in the morning, who's retired. Then I went to my office up front in the house and made plans to spend maybe lunch with him. But, I had my day scheduled out. And it helped. I have to really say it helped a lot. I felt more productive and more purposeful and focused for the next day, maybe even the next week, and much less worried about the next months. I had structure, and research really tells us that that is very important. So maintain a regular time for waking up and going to bed. I cannot stress enough the importance of regular and sufficient and restful sleep. Sleep is restorative for both your body and your mind. So after you get up, very important, get dressed. It seems like a basic thing, but it's really important. I don't mean to necessarily get dressed up, although if that is something that makes you feel good, to do that. But definitely change out of whatever you sleep in. Maintain good hygiene, eat a healthy breakfast, have a routine to start your day, maybe with an affirmation or with meditation or exercise. Have some way to mark the start of your day. Remaining physically active is very important. And again, I really know that it feels like options are very limited right now, but try to think of activities that you could do in and around your house or apartment, such as gardening, or I know many of us and maybe many of you had grand ideas of cleaning out the garage or getting through that pile of paper and moving things around, getting down and cleaning those baseboards. Anything that physically engages you. Go for a walk, play with your pet, learn how to do yoga. But don't just try to stay physically active. Stay mentally active as well. Read a new book, do a puzzle, try to learn something new, become a bit more tech savvy maybe, try a new skill, learn a new fact, journal. Journaling really helps a lot. Write down your thoughts. Importantly, take some time every day to focus only on your well-being. Do what makes you feel good. Take a bath. Try focused breathing, particularly abdominal breathing. Try aromatherapy. Scents like lavender or chamomile or sandalwood can be very soothing. It's also helpful to establish a schedule for the next day so that when you wake up, you already have a few things outlined. Try to write down a list of activities for the next day before you go to bed. And I say this because it's been my experience with lots of people that I've been working with, that waking up and wondering what to do with your day can very easily lend itself to not being able to find a good reason to get out of bed at all. And you must get out of bed. Try to limit the amount of alcohol, drugs, and tobacco that you might be using. Under stress, people tend not to really notice that they're utilizing these unhelpful coping strategies too much. The same goes for food. Try to eat healthy, get to or maintain a healthy weight. It's also very important that you identify triggers that increase your anxiety or your feelings of sadness or hopelessness. Limit your exposure to media, to the news reports with detailed statistics about infection rates and lives lost. We are all continuously bombarded by information from various sources, much of which we can do nothing about, right? pick a trusted news source, preferably one that's not trying to sell you something, that is just giving you information. Pick a time of day when you actually access that information. Don't kind of get into the habit of this steady diet of bad news and scary news. Try to differentiate between the things that you have control over and those you don't. It might be tempting to spend time thinking about all of the what ifs, or maybe that's your natural go-to. Maybe that's what you do often, well before COVID started, worrying about what might happen. The problem with that is that we tend to automatically lean toward the negative, which of course is not helpful. If you struggle with worrying thoughts, try to identify some time during the day and set aside some worry time, maybe 30 minutes at a specific time of the day regularly. Make a list of worrying thoughts as they come up during the day. And once you've written them down, then try to distract yourself with other activities until you reach your designated worry time. Okay, that's when you take out your list, and you may find that some of the things that you wrote down, now that you're reading them, don't seem to matter as much as when you put them on the list. Try to really limit the amount of time that you spend worrying about things that are not under your control. Another thing, and I think particularly like this one, is to develop a practice of gratitude. Spend some time at the end of each day kind of reflecting on some ways which you can be thankful. Try to be specific and recognize that you can find gratitude really even in the little things that prior to these challenging times maybe you would have overlooked. Practice mindfulness throughout the day. Take notice of your environment. Sometimes it may feel like the walls are closing in on you, that you're trapped in your house or your apartment or your room, but look around. Try to notice and appreciate details. Look out the window if you can, or go outside. Appreciate, I don't know, even the way that clouds are shifting in the sky, the breeze that slightly moves the plants or the trees. For me, it's birds. I find myself noticing how many different birds come into my yard. It's amazing. I didn't know there were that many. If you have coping strategies that have worked for you in the past and that are currently available to you, start with those. Right? Use others, some of the ones that we're mentioning, but start with what you know has worked for you. You don't need to reinvent the wheel. But also reach out to your community and maybe take note of some of your cultural or traditional supports that are available to you. Use anything that is helpful. And know that, as Dr. Perez said, how you're feeling is to be expected. It is not necessarily pathology, but we're going to talk about that a little later. Okay, I think Dr. Perez is now going to talk to you about the importance of connection. See there? Yeah.
Thank you, Dr. Monroe. Yes, connection. That's the word of the day for me. So Johan Hari is a journalist from the United Kingdom who has done a lot of work around how people copes with depression. He has dealt with depression himself. And he has a phrase that I really like. The phrase says, the opposite of depression is not happiness. The opposite of depression is connection. So I spoke earlier about how the impact of loneliness can have a very negative effect in our health. So the opposite is also true, and this is based on strong social science. Maintaining a strong sense of connection, keeping a feeling of belonging, kinship, closeness to others is one of the top predictors of health. It increases the chances of living a long life and living a healthy life. And very importantly, when they do studies in people who have survived very difficult trauma and are able to move beyond the trauma, and in some ways, COVID-19, I would say, is a traumatic experience for many of us. The number one factor indicating that people can do well or can do better in times of adversity is the sense of close connection to others. The single most important variable. And it's not surprising. That's how we have survived across history, by living together. All of you know this from your personal life experiences. At your most difficult times is the presence of others who has sustained you. Couples, families, village, tribes. We are social beings by nature. It's interesting how a group of social scientists doesn't speak of loneliness or the feeling of being disconnected as a symptom of depression, but they actually present it as a warning biological sign that says, pay attention, your social body is in danger. Do something about it. So just like hunger is a biological sign that tells us we need to eat, or thirst is a biological warning sign that says we need to drink water to avoid dehydration. Loneliness, in any form we experience it, rejection, grief, being homesick, missing someone you love who's gone, is a sign that we must deepen or expand our connection to others. Now, we know social connection is the best protector in times of adversity. Yet, during COVID-19, we need to shelter in place. We need to keep physical distance from each other to avoid exposure to the virus. So here we have a very difficult question to answer, because the thing that is going to help us the most right now is a little bit difficult to achieve. But remember what I told you at the beginning. It can be done. Just like we will be very creative at finding food or water if they were difficult to access, we must invite our creativity to figure out how we can improve the connections that we have and develop new ones. I'm going to talk to you about 3 ways that social scientists say we can do to develop connection in our lives. The first one, cultivate emotional closeness with a few people. Emotional closeness, that feeling of being close to somebody, that you know that you get them, you know they get you. You may have a few disagreements and some hard times, but at the core, we know you have each other's back. Acceptance and love. Susan Pinker is a psychologist who has studied the effects of loneliness in our health. And she has a concept that I really like. She talks about the idea of building a village, not a physical village, but an emotional one, a connected village. And what's very good about her studies is that the number of people that you need to have a connected village is 2. That's right. Being connected to at least one person, 2 or 3, is going to have a positive impact in the way you feel about yourself, about others, and about the world. Doesn't have to be an intimate partner per se, a spouse or a romantic partner. A good friend can save lives, literally. A good friend can help you to feel less depressed. Connection with a good friend will help you to feel less anxious and more hopeful. There's research that says that people who get together in some capacity, now it will be virtually or through the phone, with one or a few good friends once a month, have a better look about life that people who don't get together with friends once per month can make the difference. If you're fortunate to be sheltering in place with someone you love and you feel very connected to, the challenge, I think, is to build intention. We are going through a lot. And as I said earlier, when we're going through a lot, we tend to withdraw. One thing that I'm learning that works very well for my wife and I is that, we have the kids, we have our jobs, and we must decide this is gonna be our connection time. Saturday, 7 to 9:30 p.m., nothing else but just you and I. If we're not intentional about it, we may miss the moments for connection. Now, I'm aware that many of you are living alone, or some of you may have people in town or close by who you feel very close to, but because of social distancing, it's very hard to be face to face. My invitation is that even with the challenges of social distancing, that you find a way to stay connected to them. Maybe invite them to eat through a Zoom call, or write them a letter, or bring back the classic and very good phone call. I have received a couple of phone calls from friends who I had not heard in years, and it was very refreshing. And then I pay forward the favor by calling friends that I had not called in many years. And I'm talking 10 years, maybe even more. We get used to being away from each other. We think there's going to be time. But in some ways, COVID-19 is helping us to revalue how do we relate to each other. So, close social interaction, connection in any form that you can maintain with at least 1, 2, or 3 people is likely to make a difference in the way you feel about yourself, other people, and the world. A positive difference. Social scientists have also talked about a second type of connection that is maybe undervalued. Some people may think it's too trivial, but actually it's proven to be very effective at helping people keep a sense of connection to humanity. I'm talking about those minor, simple exchanges that we have with people. If you are going to the grocery store, maybe the cashier that is helping you to pay for your groceries. If you have to see the doctor and you need to come in person to get some labs, maybe the simple hi, how are you exchange that you have with the people at the front desk. Those simple questions, how you doing? Thank you very much. It's good to see you, are proven to us to have a positive impact in our emotions and our physical health. One of the refreshing experiences I have had, and speaking of gratitude, one of the moments of gratitude that I have had in these difficult times is seeing more people walk in the neighborhood and just walking by and saying hi to them. It brings the awareness that indeed all of us are struggling, but at the same time, all of us are trying very hard to make it through. I used to joke that the only time that people walk in our neighborhood was during Halloween. So it's good to see that that's happening more and more. And at the end, it's not surprising because it's a time that is, as I mentioned earlier, it's helping us to revalue what's truly important to us and the place that community and connection has in our lives. We don't take it for granted anymore. So everyday connections, to the extent that you can build them into your everyday life, saying hi to the person walking by with their dogs, saying hi to the person delivering your mail, is likely to help you with your mood. And the last type of connection that I would like to talk about, also proven to be very effective based on social science, is connection with a greater cause than yourself. Specifically, being part of an organization, volunteering, helping out. It can be anything that speaks to your interest, your heart, and your passion. And again, I'm very aware that in the time of COVID-19, it's very difficult to show up and volunteer in person. In fact, that could be some of the loss that you may be experiencing, that the places where you used to go to nurture community and belonging are now closed. So let's bring creativity back into our lives. To the question I shared earlier, of how am I doing, I would like to add a second question. What is my passion? What do I truly care for? And the answer can be as diverse as the human experience. One of the exciting things about living in Tucson is how many diverse cultural organizations and community organizations exist. Maybe this is the time to learn about one more and figure out, how can I help? And it's not so much about writing the check, although I'm sure they will welcome that, but it's about being connected with other human beings who share a common interest and a common purpose. One of the top indicators of well-being alongside with connection is maintaining a sense of purpose. I'm thinking of Viktor Frankl, who is a personal hero of mine, a psychologist and a Holocaust survivor, who said, if you have a why to live for, a reason to live for, you are going to find the how. And this is where we are. This is a hard time, and this is a good moment to ask, what is my passion? How can I help? I'm just mindful of time, and want to make sure we have time for questions, which probably it's something that you would like to bring to us. So let me just close with this. There is Vivek Murthy was the former Surgeon General in the United States from 2014 to 2017. And he had actually, before COVID-19, what he did, and he just wrote a book, Team Thoroughly Together. And maybe we can put it on the chat later so you guys can have it if you would like to look it up. He wrote a book in which, based on his experiences talking to people across the United States, big cities, small cities, and the question that he was asking at the time was, what do you need? How do you struggle? And people were not talking about diabetes and obesity, although those were part of the concerns that they had. For sure, substance abuse. But what surprised him the most, it was the high number of people who said, I'm feeling lonely. And what he says is that we must change our approach in society. We have to build a more people-centered society. And I think COVID-19 is bringing us back to that core idea. How can we build stronger communities so that when we struggle, we truly care for each other, especially the most vulnerable? There's a phrase in his book that says, it's actually a phrase he borrows from African tradition. The phrase says, if you want to go fast, go alone. If you want to go far, go together. And with COVID-19, we're gonna have to go very far. There's a lot of things we need to pay attention to, but I trust that the social science backs my trust, is that as long as we're able to keep connection to each other, we're going to be able to cope with this very big challenge of our times. Dr. Monroe, I don't know if you would like to add something else before we open it up to questions?
Yeah, thank you so much. Lastly, I want to just say, if it all becomes too overwhelming, please seek help. It makes sense to feel sad at various times during this health crisis, to experience anxiety, which is a normal human emotion. But neither feeling sad nor feeling anxious should overtake your ability to cope with day-to-day life. If talking to your family, to your friends, to caretakers, or clergy, if that's not enough, if it's not having enough of an impact on your ability to cope, then it's time to seek help. Obviously, there are clearly conventional ways, such as individual or group psychotherapy. There's a range of psychotropic medications that are also available for anxiety and depression. Other options include 1-800 support lines, which provide a range of services from linking you to a resource, to talking to crisis, to taking crisis calls and dispatching emergency response services. There are now also a variety of apps for those of you who prefer self-help resources. The main message that I guess I want to end our portion of this talk today is, and I stress this very often to my patients, seeking help is not a sign of weakness. It is absolutely a sign of strength. Knowing when to ask for help means that you are a strong person. It is not a source for shame or embarrassment. It does not speak to weakness. It is a sign of strength. So with that, I guess we want to open it up for questions, and if moderators can help us organize some of the answers for the chat, I would appreciate that. Thank you very much for your attention as we were speaking, and we have about, I think, half an hour to answer some more questions. Thank you.
Well, thank you both so much, for Dr. Harrison-Monroe and Dr. Perez. We really appreciate your time today, and we've been compiling some questions along the way, and I'll bring some people on, and we'll get started. But if anybody does have a question, please pose it in the chat, and we'll do our best to get to you, or at least compile the questions that we're seeing that are most common from people as well. So the first one we have is Betty Epler. Let me see, Betty. Whoops. Betty, if you can unmute yourself, if you'd like to ask your question. There you go. You're on.
My question had to do specifically with retired people who are still working. It's easier to have a schedule, as you were talking about. But those of us that have most of the things that we liked to do before, volunteering, going to meet with friends, going to the theater, going to the movies, just, going even to Mount Lemon, were things that we were able to do. And now it seems like our circle is getting smaller and smaller. So I know that Dr. Perez talked a little bit about being innovative and, seeing these things as a challenge and trying to figure out some other things to do, but just any suggestions you might have.
Sure. So I would, yes, you're right. Setting a schedule when you're not around work can be challenging. I would say identify some activities that you used to engage in and see whether or not some of those you can still do, just in a modified way. So for example, you mentioned volunteering. There are lots of agencies that are still looking for volunteers that that reach out to the community, that make phone calls to people who are alone or who don't have anybody to talk to, and just have a conversation, chat. It's sort of like visiting somebody in a hospital before, when that was possible. That's no longer possible, but you can potentially make a phone call to somebody. You mentioned going up to Mount Lemon. It sounds like, I think from the news I heard, the road to Mount Lemon is going to be closed until November. So that's a big deal. But Tucson we're kind of surrounded by mountains, right? So maybe this is a time to go exploring, go look what other paths you can find to take a hike with a friend, or just to drive. I know a lot of people would just get in the car and drive just so that they can get out of their house. I would say things like when you were talking about going to the theater, or I know that a lot of people have had kind of chat movie nights where they all at the same time watch a particular movie and then talk about it from the comfort of their living room. You can see one another, respond to a funny line in the movie. I think Dr. Perez mentioned having dinner together. So fix your dinner, sit in front of the camera and link to a friend and have a conversation as if your friend were sitting across from you. So in terms of activities, those are some things I might suggest based on what you've mentioned.
I'm going to bring on Bruce Kaplan. Bruce, if you'd like to ask your question, unmute yourself. There you go.
Thank you, Scott. Thank you for the great presentation. It's very helpful. Would you specifically address the challenges some of us might have dealing with someone with mental health issues who is dependent on Arizona's Medicaid system and its limited resources and is isolated and locked down in an assisted living facility for almost 5 months?
Yeah.
Sorry to do that to you.
Yeah. I think this is one of the problems, right? And so I know I've seen some innovative things on television where people kind of showed up in front of a nursing home at a particular time every night and held up signs if they couldn't directly communicate. If there is, for example, someone, if there's access to a phone, it doesn't need to be a smartphone, but just even a phone where you could have on a regular basis a phone call with your loved one who is in this lockdown facility. Trying to, and this is obviously an extremely stressful situation for everybody, including the staff that work there. And so probably trying to identify somebody who is willing to help your loved one make that connection might be difficult to find, but I would try. Sending a letter might also be helpful. Unfortunately, if they're in a locked facility at this point, there is not a good way for you to actually, even this through the Arizona Medicaid, through Access system, programs have peer supports and case management services of people who go out and do home visits. But obviously, if this person is in a assisted living facility that's locked down, they're not able to get in either. So unfortunately, I don't have great advice around that other than try to continue to connect and encourage the person to connect with you whenever they feel like they need to talk.
And the other thing that I would say, and this is very challenging and indeed for people who have serious health or mental health conditions and limited access to connecting to others. In my experience, I have clients who are in residential places and I give them a call and that's covered under telehealth. And just sometimes, even if we don't talk a lot, if we don't have a lot of sessions, just knowing that there's somebody out there they can call. For some of my clients, it's very hard to manage technology, some of my older clients, and some have a hard time doing a long session, but just the experience of knowing I have someone available who can support me in difficult times, go back to connection, once, twice, 3 times per month for 15 minutes. Again, none of this is enough, but every little bit can be hopefully a bit helpful.
Yeah, I would also say it's helpful for the individual to know that they haven't been forgotten, right? That even though they can't get out and they're their ability to interact with others is limited, it's really important to have the reminder that somebody out there knows I'm in here and they haven't forgotten. So I don't know if you've tried making phone contact with this individual, if that's a barrier or if that's possible. But if it is possible, I would do that on a very regular basis, again, to address some of the cognitive impact that lack of interaction in your environment has on individuals.
Okay, we're going to go to a question. I'm not sure I'm going to get this last name right. Marie Perez, if you can unmute yourself. Marie? Marie Perez.
Okay, I got it. Sorry,
Yep.
It took me a minute.
You're fine.
Okay, well, thanks so much for calling on me, and I've enjoyed and learned a lot from today's presentation, so thank you both very much. So I find myself struggling with a great deal of anger because of dashed plans, completely dashed for the entire of 2020, big events and such, off the radar screen completely. I'm angry about how circumscribed my life has become. I find myself being, and how it's really expressing itself, which is distressing, is in conversations that I've been having in a safe way with neighbors and such, where if they disagree with me about what's happening with COVID-19 or about politics, I just get really angry at them, and it takes me a long time to get over it. And I tend to perceive disagreements as almost attacks, which they probably are not. But how do you dial down that intensity and get back to a place that's more reasonable? I mean, I'm afraid I'm going to like alienate everybody I know at this point. So that's the question.
Thank you, Mary. So just like I said, if you're feeling sad or anxious, you are normal. You're feeling angry. It makes perfect sense. I mean, your question reminds us of how much we have lost, right? And it's just impossible not to have some sense of this is so unfair. This is not what was supposed to be. So then the question that's left is what to do with this anger that we carry. And we carry mixed emotions. We carry sadness, depressions, anxiety, hope, and joy sometimes, and then we carry anger. So I think by naming it, you are ahead of the game. Just recognizing that this is what I'm going through is the first step to learn how to deal with it. If you don't know what the problem is, it's very hard to do something about it. The second thing that I will recommend is if you could not so much try to get rid of the anger, but this may sound counterintuitive. Welcome the anger. Enter in conversation with that anger. Let it teach you something. It's not easy to do, but it's the kind of thing that we aspire to do better day after day. Imagine that anger sits next to you and asks this anger, what is it that you are here? When do you show up with more strength? What is it that I'm truly angry about? And see if that opens some path to self-knowledge, and actually the anger becomes more of someone who's on your side trying to figure out how you're coping with everything that's going on. I think the more you engage with it in healthy, safe ways, the easier it's going to be to deal with it. I don't think it's going to go away. Maybe I'm wrong, and maybe one day it's gone, but it's the kind of thing that we're going through a lot, and some days, depending on what you hear and where you stand and what's happening, is a scream is what happens, right? That's what we do, and then we try to deal with it the best way we can.
Yeah, I would add that being aware of the situations that do make you angry, that tend to lead you more to this place that you feel is out of control and out of proportion. Try to approach, if you're going to have conversations with your neighbors, approach that knowing that this conversation is likely going to kind of, get your ire up a little bit, make you feel the frustration that you're feeling. And so either as you're feeling that it's getting out of control, find a friendly way to terminate the conversation, to end it. Engage in some kind of relaxation as you're starting to feel that tension rise in your body. Take some deep breaths, kind of the diaphragmatic breaths that you take where you are not moving your chest, but you're moving your belly in and out. And basically, if you put your hand on your chest, that it doesn't move when you're taking a deep breath. What you're trying to do is really fill your lungs, and also give a signal. By doing that, you're signaling your brain that you are calm. When we breathe through our chest, it's a signal that things are, we need to get ready for battle, that we need to run, or we need to, it heightens our awareness, and it doesn't calm us down, it further excites us. So I would say, try to do some deep breathing as well, maybe even during the conversation that you're having that is a bit challenging for you.
Another question from a Lindy Elias. Lindy, if you'd like to unmute yourself. There you go.
Yes, hello there, and thank you for this insightful and very practical presentation. I'm wondering, how does one begin to know that a coping strategy is actually impairing one's ability to function, quote, normally? What are the symptoms? What are some of the signs? Thank you.
So, I would say recognizing that you are using something as a coping strategy is the first step. You need to realize that whatever activity or behavior you've chosen is meant to release or decrease the stress or the distress that you're feeling. And if that's not happening, really look at what coping strategy you've chosen. All of us have lots of different coping strategies. And so it may be that this is one that works in some situations, but not across the board. And so you may need to become very selective about coping strategies, what you're using. So for example, a lot of people, and I don't know which coping strategies you're referring to that might not be working, but some people drink and say, well, I drink because it calms me down or it helps me go to sleep. But really the opposite effect is true for alcohol in particular. If you're drinking to the point that it's making you sleepy enough, it's kind of dulling your brain. It's not actually helping you fall asleep and get restful sleep, get REM sleep, where your body actually can regenerate during that sleep. It's sort of like you get knocked out, and then usually you wake up in the middle of the night because there's a rebound effect particularly for alcohol. But in terms of, I don't know if you want to mention a specific coping strategy that you may feel is not working so well. Lindy.
Nice. Any particular, sometimes what's happening to me during this pandemic is that I'm enjoying the social isolation and being more selective and having to be more selective in how I, quote, socialize. And I'm just wondering, am I isolating too much? I enjoy my company, and I'm also I was a very social person. And there's certain things I do wholeheartedly miss, being in the music of Tucson and the crowds and the Festival of Books, my beloved Festival of Books. But I'm adjusting to this pandemic and the imposed isolation as a senior, having, impaired medical issues. And I'm just questioning my own viability in this situation. Am I isolating too much? I suppose that's where I am right now.
Okay.
So what I was, go ahead, Harrison-Monroe.
Yeah, I was going to say, so for some people, this is actually a welcome kind of relief and a little bit of downtime. And some people are really good with spending time with themselves. I think you would notice that if it's leaning more towards isolation that you're experiencing, if you are in fact not going to bed at regular times, sleeping in, doing a lot of lounging and napping all day long, kind of losing track of time, less and less being willing to kind of reach out and take the initiative to connect with people. I would say that's where being okay with being alone is good, but you cross the boundary when you start really disengaging. And disengaging is different from just having some quiet time and appreciating being by yourself.
And then I would just add, you make a very good point that I meant to mention during my presentation, that solitude, being by yourself, is good for the soul. In fact, we need to have moments of solitude in order to have the ability to meaningfully connect with others. So I'm glad you brought that up because it was an important point to make. Thank you.
We have Kirsten Yaffe, if you can unmute yourself.
Okay, am I unmuted?
You are. You're
okay. I'm finding that I'm like so unmotivated that I'm not getting anything done, and I have lots of stuff that I should be doing, could be doing, but it's like I'm not sure I'm motivated enough to even care to bother to, get on a routine or have any sort of regularity. It's like I just don't care. I'd rather just sit and play on my phone, playing phone games for 8 hours a day or some, or whatever useless things I can be doing with my time. And I'm just wondering, how do you even get over that, get motivated enough to want to get motivated?
Great question. We could do a whole presentation on that. So I'd say two things here. Typically, the question is, when I feel good or when I feel better, I will do that. I would say, see, you can invert the question. Do something first, and again, be very intentional. Choose something small, something that is within reach. Make a commitment to yourself. I want to do, there's only one thing I'm going to do today, is going to be this. I'm going to clean my desk. I'm talking from personal experience here. And do it no matter what. Like if your life depended on that. Show up, clean your desk, clean your windows, whatever you want it is, and then check in with yourself. Have that conversation. What allowed me to do this? How do I feel? Did anything change in my sense of motivation or not? That's a good place to start. The other one that has been very effective with my clients during this time is to do a short to-do list for the day. And again, keep it very simple, and then give yourself permission to do nothing or to just be unproductive the rest of the day, and don't give yourself a hard time. Remember, we're going through a lot, so we have to be kind to ourselves.
Okay, thank you.
Sure.
all right. Let's see. I'll try Bob Offlick. Let me see if Bob. Whoop. Bob, if you can unmute yourself. There you go.
Hi. It seems when you go out in the community, you see more and more members of our community stressed out not able to cope with COVID and the changes it puts on us in a store setting. I'm just wondering how we can help each other and be supportive of one another, knowing that those extra stress is put on seems to be unmanageable.
So again, I think the fact that you're aware that this might be harder for someone else than maybe how you're managing is a good start. Really exhibiting patience towards the other person who seems to be easily stressed or more stressed. In grocery stores, I've been in a grocery store where, even though they have arrows down one lane, and somebody was walking in the opposite direction of the arrow, and somebody else said, "Don't you see the arrow? What are you doing?" And the person was just very taken aback because they hadn't noticed the arrow, and it just became kind of more than it needed to be. And I said, "What is it that you were looking for in this lane?" Because the person was just at the beginning and was kind of blocked by the other person. And he said, "Oh, I was just looking for I think it was some condiment, not ketchup, but something." And so I just kind of took it and I handed it to the person, and then they were able to kind of leave. So I think doing very small things for other people that help diffuse the situation, that make them feel a little bit more comfortable, that assume that their behaviors are not intentionally meant to offend you or to cause you harm. Just being more patient with one another and coming from a sense of I'm part of this community and I know it's hard.
Okay, we've got about 5 minutes left for questions. We're going to have Cheryl Stevens Kirkland. If you'd like to come on and ask your question, just unmute yourself. There you go, you're on. Cheryl, can you hear us? Her microphone may not be working. I'll go ahead and ask your question, Cheryl, and if you can get it on, go ahead and chime in. But she says, "I'm a social worker at Banner, and I work with people receiving cancer care. In the past week, there have been 4 suicides. This has had a shock impact because there were no signs or symptoms from the patients that they were having difficulties. Is there a better or more effective way for me to assess the patient? This also has affected the staff, and it's bad enough when a patient passes from cancer, but from suicide can be shocking. Any suggestions?"
One of the things that I think people often are afraid of doing is to talk about feelings, thoughts of suicide, to allow the person who might be going through significant distress that they're trying to hold together and trying not to show, to allow them to actually name it and talk about it. Particularly people who have significant medical conditions are at high risk. If the care providers, whether it's clinicians, doctors, social workers, are able to allow the person to talk about the high level of distress, mental distress that they're experiencing, including saying, I'm not sure how you're handling this. I hope you're doing okay. Do you need some resources? Do you need to talk to somebody? Are you, the people in these stressful times are even considering suicide. Are you there? Are you in that place? Very often that allows the person then to say, "Okay, yeah, I've been meaning to tell somebody, but you guys already take such good care of me, and it seems like you're only dealing with cancer, so this is probably not the right place for me to talk about what some of my mental health concerns or worries are. So allowing the person to talk about it, and then be ready to have some resources available. Obviously, if you think somebody is in urgent need, making that referral right away, not letting the person just leave, but recognizing that they're coming to you and talking about this because they actually are asking for help. Sometimes patients will say, well, I told you this in confidence. I don't, I didn't know that you were going to call somebody else, and, but it's okay. I'd rather have somebody angry with me for having acted than having not said anything and they go and commit suicide. So I think raising the topic and not being afraid to raise the topic, because if you've thought about it, they've thought about it.
And Cheryl, I just want to say, I'm sorry about this. This is very traumatic for all of you as providers. And a very practical note, I would say, put some posters up. Are you thinking about committing suicide? Let's talk. Let people know that you are okay having the conversation in more than one way.
All right. Rod Norris, would you like to unmute yourself, Rod? There you go.
Yes, my question is, as a grandparent, and I've heard other folks who are grandparents who are concerned about the effect of the isolation on their grandkids, and particularly in families where the non-custodial parent and grandparents are prohibited from seeing their grandkids because of the isolation policies that we're expected to follow. And also, what the effect is on the parents and grandparents. They're missing part of their grandkids' lives.
Yes. Yeah, that's where I'm at. I think one of the, people are very used to now texting. And I've often said, and when I say this to my med students, if you have a phone where you can text, then why not make a phone call? And if you have a phone that you can call on, then why not, if you have the capacity, actually connect via video. It is very different experience to see somebody, a loved one that you want to interact with, versus just hearing them. You can see that they're doing okay. You can laugh with them and kind of see what game they're playing. They can show you. Very young kids particularly are very used to this kind of medium. And so while for some of us, I certainly speak for myself, this was not an easy transition for me to make, but it has made a big difference to connect visually and just, have the parent or even the child kind of hold the phone, and they can show you what they're currently working on or what they're playing with, and just have a conversation with them as if they were in the room. I think in terms of the long-term effect for kids, we've already been, I think, because of our insistence and emphasis on media, a lot of our children are already very isolated. They think they have thousands of friends because they have people following them on their social media, but they really are sitting by themselves in a room. So we know already from research that has long-term effects, negative effects in terms of their ability to engage socially with other people. And so that's another reason, I think, to really put an emphasis on any kind of connection, if possible, and ideally a visual connection that you could make.
Well, we are a little past time, and I think we'll stop there. There's so many great comments, people putting all the wonderful things that they're doing, and from doing online education, whether it's with programs like ours with Ollie or other online options that they have, and people getting involved in all sorts of new hobbies and interesting things around that. But there's so much more on this. I'm sure we could talk all day, but I really appreciate your time today and appreciate you offering this session to us. We will be back again next Friday at 2 p.m. for part 2 of this session. And any of you who registered will receive reminders next week with all new passwords and links to that session. And we'll also continue to forward resources to you, including the videos of the presentations and the like. So thank you all again so much for your time today, Dr. Harrison-Monroe and Dr. Perez. And you guys do an incredible service to the community. And I am certainly familiar with the Early Psychosis Center, Intervention Center, and it's an incredible place and is a valuable resource to the community. So thank you so much for joining us again today. Do you have any other parting words or thoughts?
I'm seeing some questions about volunteering, and so maybe one of the things that we can do is we can put together maybe some talking points and some ideas about volunteering and other activities that we can send to you, and you can maybe then distribute to all the participants.
And thank you, everybody. I just was gonna say thank you.
Yeah, thank you very much.
That's my last word.
Well, thank you both. And yeah, another great resource is the pcoa.org, the PIMA Council on Aging, for our folks dealing with issues in aging, and volunteer resources are usually linked off of their website as well. But thank you all again. We'll see you next week, and everyone be well, be safe, and take care. Thank you so much.
Ciao.